Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Today, we'll learn what pulmonary rehabilitation is and who may benefit from it with my guest, Caitlin Farruggio. She's a doctor of physical therapy, and she's the lead physical therapist for the pulmonary rehabilitation program at Upstate. Welcome to the Informed Patient, Dr. Farruggio.
Good morning.
Who might need pulmonary rehabilitation?
Individuals with any type of lung condition would benefit from pulmonary rehab, and anything that could affect their breathing or ability to perform day-to-day tasks and their function in everyday life. This could include people recently diagnosed with a lung condition or recently discharged from the hospital with any type of breathing issues, or maybe they've had respiratory issues for years and this person does not technically have to even be on oxygen or severely limited to receive pulmonary rehab.
So it could be for illnesses or injuries that are acute or chronic.
Yes, correct.
Now, do you see adults and children?
Yes, we do see primarily adults, but we also see some children who maybe have some asthma or are having difficulty keeping up with their peers or maybe have some medical issues.
Well, let's talk about some of the illnesses that you might treat. What is COPD? I hear about that often.
COPD stands for chronic obstructive pulmonary disease. It is a progressive long-term disease that makes it difficult to breathe by causing an inflammation and damage and obstruction in the airways. So it consists of chronic bronchitis or emphysema. Typically, people have one or the other, and that falls within the diagnosis of COPD. They could have both, typically one or the other, and it's diagnosed by doing specific breathing tests called spirometry, along with blood work and chest x-rays and the physical exam.
What about fibrosis?
Fibrosis, particularly pulmonary fibrosis, means scarring. And so people with pulmonary fibrosis, they have fibrotic tissue or scarring in their lungs that kind of stiffens the lungs and blocks the movement of oxygen within the air sacs to the bloodstream. And this can contribute to the shortness of breath. And usually they have a dry cough. Cystic fibrosis is a little bit different. It's a progressive inherited genetic disorder causing severe damage to the lungs, pancreas, and multiple other organs, so that it also affects the lungs, but other organs as well.
You talked about bronchitis and emphysema. Do those conditions lead to pulmonary fibrosis?
Nope, they are technically two different things.
Now, what about asthma? Where does that fit in to possibly pulmonary rehab?
Asthma is a chronic long-term lung disease that also causes inflammation and swelling and narrowing of the airways, which can make it difficult to breathe. And so the people with this condition also could benefit from pulmonary rehab.
Are there lung surgeries that may leave a person in need of rehab afterward?
Yes, we see quite a few patients with any type of lung surgery. So some common ones that we see are lung reduction surgery, such as a lobectomy or pulmonary resection. So they took out part of the lung that maybe was diseased. Also, we have been seeing more patients with a newer type of surgery called a Zephyr valve surgery, which they put these valves into the lungs and the airways to help deflate the lungs. It's a one-way valve to get the carbon dioxide out of the lungs for people that typically have COPD, that their lungs are expanded too much with carbon dioxide. And then lastly, we also see people post-lung transplant for pulmonary rehab.
Oh, so they may travel from Central New York because Upstate doesn't do lung transplants, but then they come back here to do the rehab.
Yes, we see people from all over, and sometimes they come prior to the lung transplant, and we see them to try to build up endurance. And then they will go to various hospitals that do the lung transplant, and then they'll come back to us for the rehab as they live more locally.
Now, are there any lung conditions that would not benefit from pulmonary rehab where that's contraindicated?
I would say no condition specifically that I can think of off the top of my head, but it's more so, does this individual tolerate physical activity? So if their blood pressure is very, very high, or their heart rate is very, very high, or maybe when they're exercising, their heart rate goes really down low significantly when exercising, they would not benefit well from exercising at that point, and so they would need to follow up with their medical provider and try to get things under control.
Can you tell us what pulmonary rehab is like? Where does it take place?
Our pulmonary rehab is a little bit unique, as a traditional pulmonary rehab involves nurses, respiratory therapists, and exercise physiologists. But our program is actually run by physical therapists, and we bill through insurance. So we're a little bit different from that aspect. For our program, the physical therapists evaluate the patient on the first day, which is about a 1 hour session. We discuss the medical history, any limitations and goals of the patient, and then we get baseline measurements of their walking tolerance, their general strength and balance and mobility, all while we're monitoring their vitals, their oxygen, and their heart rate. And then for treatments, we typically see patients anywhere from 30 minutes up to an hour, depending on the individual and what they can tolerate. And typically, we strive to see them about twice a week, and it can be up to 12 weeks, which we base off the research. We typically aim for 15 to 30 minutes of cardiovascular endurance training, whether it's walking or a seated bike or stepper machine. And our goal is to try to maintain their heart rate and their oxygen within a specific level that's safe to exercise, but more intense so that they are actually working. And then we also incorporate strength training once they're able to tolerate that. We strive for a goal based on the research for about 24 visits, give or take, before we discharge them. And then the goal is for them to go to a home program and focus on the techniques that we've taught them.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Caitlin Farruggio. She's the lead physical therapist for Upstate's Pulmonary Rehabilitation Program. Let's talk about the components of pulmonary rehab. Why is supervised exercise necessary?
Supervised exercise is very important, especially with individuals with a lung condition, because typically these people have not been exercising on a regular basis and might not know how their body's going to respond to exercise. So we focus on monitoring their oxygen level and their heart rate based on the individual and specific medications that they're on. We calculate a goal for their target heart rate to be within a moderate intensity to exercise. And we try to maintain that and encourage them to find the happy medium to push themselves enough to get to that point without their oxygen declining.
What sorts of things do you find yourself teaching patients about the most?
I'd say initially breathing techniques. So a lot of people have difficulty breathing with any sort of lung condition, and then we kind of get caught in this vicious cycle where we feel out of breath, and then we feel anxious, and then we feel more out of breath because we are anxious. And so just starting with pursed breathing and diaphragmatic breathing are good tools that people can utilize when they're not in physical therapy and just exerting themselves in general and feel out of breath. So typically a lot of breathing exercises to start. So a lot of cues of smell the roses and blow out the birthday candles for the pursed breathing. And also just recognizing the difference between feeling out of breath and working hard as if you're exercising versus feeling out of breath to the point where, yes, you need to take a break now.
What is the difference between just regular breathing and diaphragmatic breathing?
Regular breathing, we do use our diaphragm. So in that sense, it is very similar, but the diaphragmatic breathing is a way to kick in your diaphragm a little bit more and kind of reset the movement of your lungs and the mechanics of the breathing. So we encourage people to inhale and feel your rib cage and your belly expand. And then when you exhale, you want your rib cage and your belly to come back in. And that can help, again, kind of resetting the nervous system also.
So it sounds like a lot of this, the breathing techniques, these are things that patients can do and should be doing on their own when they're not at rehab. And then they come into rehab and you make sure they're doing it right, I guess.
Yes,
Oh.
yes, definitely.
Can these breathing exercises make a long-term difference for people?
I think they can, especially when someone is out in public and maybe they're walking a certain distance to get to the grocery store and whatnot, and they're starting to feel really out of breath and anxious, and maybe they don't have anywhere to sit. If they can go back and use these techniques, it can be helpful to get their oxygen up or just improve their shortness of breath.
How do you measure success in rehab? I know you take measurements on the first day. How do you gauge improvement?
Yes. So on the first day, we do what's called a 6-minute walk test and assess their heart rate, blood pressure, oxygen, and even just their shortness of breath. We use a scale, a dyspnea scale. And then we also do a common test, 30-second stand up, sit down test to get a baseline for their leg strength and endurance and see how their body responds to that physical stress. And then every 10 visits, we remeasure. And so we see, okay, did you walk further? If so, how much further? Did you require maybe more or less oxygen compared to the first day? That is one way to show progress. And then also, is the patient reporting their quality of life maybe is changing and better? Maybe they can walk around the grocery store now further or go for longer versus only being able to get in and get one item previously. So it's a combination of the patient report and how they're feeling and their confidence level and their community tasks, but then also physically what is showing up when we are measuring these outcome measures.
So when someone tells you they have trouble breathing or the dyspnea, you're able to measure that also to kind of back up what they're telling you.
Yes. And we like to use that tool a lot during our sessions for how out of breath do you feel? Okay, you're only at a 1, but you walked further. That's great. That's improvement.
Now, you mentioned at the very beginning that you guys deal with health insurers. Do insurance programs and Medicare, do they pay for pulmonary rehab?
Yes. So for us, as we bill through physical therapy, they do cover it, and it's very individualized based on the person's insurance. So I would recommend if you do want to get into pulmonary rehab that you reach out to your insurance company and just ask, what do you cover for physical therapy? Because it can vary based on how many visits they allow, what your copay might be, and if there's a deductible. That can also determine how long or how often we might see a patient.
And do they need a referral from their primary care provider?
Yes, we do need a referral. It could come from the primary care provider. It could be from a pulmonologist. Sometimes we get cardiologists that are writing the referrals. But for us, since we are a physical therapy clinic, it does have to say physical therapy, pulmonary rehab on it. And ideally, if it says that we could titrate the oxygen to remain above a certain level, typically 88%, that allows us, if the person is on oxygen, to adjust the oxygen level if needed while they're exercising.
So if a listener thinks they may benefit from pulmonary rehab, how do they learn more?
Yes, good question. I would say you could check out our website at Upstate. If you search pulmonary rehab, it will pop up. It's physical therapy pulmonary rehab. And then also, if they do plan to schedule, we have our call center phone number, which is 315-464-6543. And they could schedule an appointment there and they will direct you to the right office.
Well, Dr. Farruggio, this has been very informative. Thank you so much for making the time.
Yes, thank you for having me.
My guest has been Caitlin Farruggio, a doctor of physical therapy and the lead physical therapist for Upstate's Pulmonary Rehabilitation Program. The Informed Patient is a podcast covering health, science, and medicine brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.